You're listening to The Art of Imperfect Adulting. I'm your host, Amy Stone. Here, I share stories from real people navigating the adventure that I call adulting. Are you ready? Me too. Let's do this. Well, hello, friends. In this episode, I'm going to introduce you to my guest, Peggy Sharr. A few years ago, Peggy went through the process of finding out that she had a rare syndrome called burning mouth syndrome. What we chat about today is what that process of discovery, curiosity, and diagnosis was. What were the choices that she made? What were the choices that she felt like she didn't have? And how all of this has impacted her life. I want to share that Peggy knows a lot about this topic. She is smart, she's dedicated, she's a trained researcher, she's written a book. She could easily give a 7-day symposium all about this topic and never run out of material. As the host of this podcast, I was trying to keep this conversation to around 45 minutes, and I don't actually think I achieved that. There are a few times where you will notice that I redirect the conversation, and I just wanted to address that at the start. I wanted you as the audience to know the reason why I do that. It's never my intention to be aggressive, to cut off my guests, or to interrupt them. I know that you are here to hear what they have to share. So, this is a very interesting story, and I'm happy to share it with you. So, let's get to it. Welcome to the Art of Imperfect Adulting. Peggy Sharr, are you ready for a fun chat today?
I am.
All right, let's do it. I have a couple warm-up questions. I ask every one of my guests what part of the world they call home. So where are you?
So right now, and call home is the loaded question for me, but right now it's Athens, Georgia. And we've been here now 4 years as of November. But I lived in Iowa for 45 years. And then before that, moved all over the country. So whenever somebody asks me, where are you from? I never know how to answer that question. But for this question, it's Athens, Georgia.
That is a very thorough and wonderful answer. Share with us something that you love or enjoy about Athens, Georgia.
Well, I love the weather. That's the first thing. Coming from Iowa, worst summers, worst winters. Spring and fall are lovely, but you get hit really hard with winter and summer. So Athens is right now it's 69 degrees outside.
Yeah.
Can't complain about that. Also, I would say that I never expected to be so welcomed in the South. Living in Georgia, people are so friendly here. Uh, just made friends very easily. Neighbors came, rushing out of their doors to greet us. Hadn't experienced that anywhere else I lived.
Amazing. The Southern charm on
Yeah.
display. Happy to hear it. Happy to hear it. So, today we're going to talk about your experience. And it sounds to me, from the little I know before we talk, that you struggled to get a health diagnosis. Getting the diagnosis and also finding maybe a way to live with this
hmm
new conditions, making all the choices and decisions that got
hmm
you there, and how your life transformed because of these decisions and all this. Are you ready to talk about that today?
Yeah, absolutely.
All right, very cool. So, over time, you figure out that you have something called burning mouth syndrome. Tell us how long ago this started and what was the beginning like? What was the first sort of awareness that you had that something was not right?
Well, I think it's important first to mention that, and this doesn't necessarily mean that it's causation, but I started having odd sensations in my mouth about 3 weeks after the death of my son.
Okay.
So I was in deep grief. I mean, if you can imagine, it was my eldest son. It was by suicide, so it was a parent's worst nightmare. So I was in a really bad place, both emotionally and physically. And so I started noticing this metallic-y taste in my mouth, but I didn't have the bandwidth to really pursue it, because I was grieving, there was family around, friend, I mean, all the things when there's a loss in the family. And so I just ignored it.
I think
I
that
knew it.
sounds reasonable. I really
Yeah.
do.
Yeah.
because I can't even imagine how distracted and overwhelmed you must have been at the time.
I was. And so time went on and the metallic taste persisted. It didn't go away. So after a few weeks, I went to Dr. Google and I started, researching, well, what could cause a metallic taste in your mouth? And there were a lot of, with Dr. Google, a lot of things come
Yeah.
back. So there were a number of things, and I did the process of elimination. I kind of looked at, okay, what are the things I'm doing? What are the medicines I'm taking? What can I do to see what this could possibly be? And so the first thing I thought was, well, maybe it's medications. So I have had, well, I don't anymore because I had back surgery, but I had chronic low back pain, like pretty severe low back pain from a car accident years ago. And so I took Tylenol every day. And so that was one of the things it mentioned was that Tylenol could cause metallic taste in your mouth. So I thought, okay, just eliminate the Tylenol. So I eliminated the Tylenol. I did find that it got slightly better, but didn't go away.
And was this
Um,
persistent, or was it when you took a sip of water,
it was
or
persistent. It was there
so
all the time.
all the time in your
All the
mouth,
time
24 hours a
upon,
day?
yep, 24 hours a day. The only time that it would settle down was when I was sleeping, thankfully. Um, I would lie down and it would take a while for it to settle down, but eventually it would settle down and I could sleep. But then I would wake up, I'd get up, start moving around, drink a sip of water, whatever, and then it would just start right back up again.
And did the sorry to interrupt you, Peggy, but
That's okay.
I have not experienced this, so I am super curious
Most
about what the
people have
life was
never
like.
even heard of it.
So it's a metallic taste. Was it when you ate and drank things? So like if you had a glass of lemonade or like because you're in Georgia, a slice of peach pie, did it mix with it? Did it interfere with the way things tasted? Like what was the impact on how
Yeah,
this was?
that's a really interesting question. For the most part, the food and the drink would overcome the taste, except for salt.
Okay.
Everything tasted really salty. I found myself being at restaurants sending things back saying, the chef put too much salt on this, and my husband would taste it and he'd say, it tastes fine to me. And I'd say, no, 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 it's too salty. It's just too salty. So that was the one area. But everything else, I got kind of a respite from it when I was eating
Okay.
or drinking, with the exception of citrus, coffee, and carbonated drinks.
Okay.
Those three things I avoided because they made it worse.
Okay.
So so coffee was just like off the table. Any lemonade or oranges or anything citrusy made it worse. But as time went on, so at this point, I hadn't even gone to the doctor yet. I
Yeah.
just was still, still didn't have the bandwidth, still grieving, just still trying to, figure out, navigate how to avoid making this metallic taste worse. Then it morphed into full blown burning mouth syndrome. So the best way to describe burning mouth syndrome is that it's a combination of feeling like you've burnt your tongue by drinking something hot, like or eating a hot soup or drinking a hot coffee or something, combined with having eaten habanero peppers.
Okay.
So it's the you've eaten hot peppers before, you've eaten
Right.
spicy food.
So I've done both those things. That first sip of hot soup or a bite of hot pizza where you burn the where I burn the
Yep.
palate of my mouth, even though I know better. I've definitely done that.
Yeah.
And yeah, I've had, hot peppers and hot sauce and had that
Hmm.
flaming experience. One of my kids is super into hot things, and one time as a present we got, actually it was a game, but we just used it as a test where it had the different Scoville sauces, and
Hmm.
I think totally inspired by that show where they eat the progressively hotter wings.
Oh, yeah, yeah, yeah.
So I don't have a super high tolerance for spicy foods, but I've done my very pedestrian version of exploration. So Peggy, you were saying this. So was this all the time? You felt like that numbness,
Yes,
swelling in your
yes,
mouth,
yes,
and the
yes.
perpetual burning.
The perpetual burning. So it's as if you eat the hot peppers, but the mouth doesn't cool off. Because, people who like spicy foods, they'll eat the spicy food, but they know they're not going to 3 hours later, 4 hours later, 5 hours later their mouth is still not going to be on fire from the,
Right.
jalapenos they ate. It's going to go away. But with burning mouth syndrome, it doesn't go away. And the sandy feeling on your tongue, like, or the roof of your mouth, like it's been burned, that persists as well. Now, I have to say that I am fortunate in that I only experience this on my tongue. So some people can experience it on their gums, on their cheeks, on the roof of their mouth. Someone who I've made very good friends with who's also in the burning mouth syndrome. And I'm going to refer to it as BMS at this point because it's just
Okay.
easier. In our community, that's what we call it. So in the BMS community, I've made a friend, and she told me that hers was even down into her throat. So if you can
Wow.
imagine that experience, even in the throat and cheeks. The other piece of it is that not everyone, but a large number of people with burning mouth syndrome also experience having lesions or ulcers inside the mouth,
Well, I was
on the
just going to
tongue.
ask you because I would, if it was, I think if it was me, I would be checking in the mirror, like with
Yeah,
like a little dental mirror, like
yeah,
what is going, like, when you get a canker sore and you're or a swollen little bump on your
yeah,
lip.
yeah, yep.
Yes. Yeah. But
So I
there's,
I had those. I had them
okay.
on the roof of my mouth. I had them on my tongue. I'd get them inside my lips and my cheeks. And so I was like, is this related? Is this separate? I didn't know what was going on. So finally, I made an appointment with my GP. Now, I have to say, and everybody knows this, and it's not just our country, it's other countries as well. You make an appointment, it's not like you go in tomorrow.
Right.
You're going to go in 3, 4, 5, 6, maybe even longer weeks out. So every appointment you make as you're going through trying to seek a diagnosis is a long wait in between. So, and my doctor, this was back in Iowa. This is when it all started when I was back in Iowa. Was a very popular doctor. So she didn't have like cancellations and open appointments and things like that. So, I had to wait quite a while to get into her. So I got into her. She looked at my mouth. She said, yeah, I see the ulcers, but nothing else. I don't see any redness or swelling and that's the other thing about burning mouth syndrome is other than the lesions, there's really no evidence. Everybody reports that they go to the doctor, they go to the dentist, they go to an ENT, they look in their mouth and they say everything looks normal. The other symptom is dry mouth. So it feels like you're not producing saliva. But when you go to specialists and they test, they find out your saliva production is normal. And people, are very frustrated. I'm part of some Facebook burning mouth syndrome groups. And, I see comments on there a lot from them, how frustrated they are that they went and were told your saliva production is normal. And they're like, how can that be? My mouth is, I feel like it's sandpaper inside there. So it's a feeling rather than a reality that's happening in the mouth. So BMS is referred to as idiopathic. Now, I should mention that there are two types. There's
So I
primary
want to
and
pause for a
secondary.
second. I want to pause for a
Okay.
second, just because I want to bring the audience up to speed a little bit more about you. Everybody who's listening is super, can already tell that you are like today a very much an expert about this, and like you're speaking very knowledgeably. One of the things that's very interesting about your story when I read your bio is that you actually are you have some clinical training as a professional
Yeah.
before you even began.
20
You're not,
years. Yes.
yeah. So
Mhm.
you're well. Tell us about that because you're not. Are you an MD or are you clinical psychotherapist?
Yeah. Psychotherapist,
So
clinical,
clinic.
specializing in trauma.
Okay,
Yes.
so clinical psychotherapist, you've done a significant amount of school. You're
Yes.
familiar with the medical community
Mhm.
as a structure where a layperson who's not would be
Right.
maybe less of knowledgeable. And also, um, correct me if I'm wrong about this. As part of your studies, you've done research and
Yes.
analysis. That's a part of your backup with this.
Yes.
And still, when you get into it, you are put into the Western system of
Yes.
go to the, if I also want to, I just want to make a note for everybody listen who's ever been shamed for consulting Google. She went to Google first too, guys.
Yes.
And then you go to the doctor who's like, yeah, you've got some bumps, go
Yeah.
home. And
Yeah.
then you start down the specialist path, which you very calmly noted is incredibly frustrating for people who are going through the process of knocking out, seeing a bunch of doctors, each one of them 6 weeks apart,
Yeah.
and then being turned away that they don't find anything.
Hmm. Hmm.
And
Hmm.
so I think that probably good for you and worth noting because you had a running head start on how to approach this and to be able to understand some of the information that was coming back to you, like
Hmm. Hmm.
medical jargon and
Hmm.
terminology and keeping track of it and that
Hmm.
kind of thing.
That's true.
So as you went through and were ready to give us the vocabulary, I was like, I need to clue the audience in
Okay.
that this is not Sally Sue from just Main Street, USA, who learned this by scratch. You had a running head start, and also give you props for the credentials that you have that you were
Oh,
able
thank you.
to like put this together and analyze it. Because I think a lot of people go, and I'm not an expert on this, but a lot of people who are doing this sort of discovery in whatever it is that they're doing, they sometimes find themselves 4 or 5 steps down the road before they realize I need to keep careful track of what people are telling me
Yes.
and what I'm
Yes.
learning because I am
Hmm.
my own detective.
Hmm.
So, all right. So you were explaining the backstory of how we classify something like burning mouth to syndrome.
Primary or
Okay.
secondary. Yeah.
Okay.
So primary is considered idiopathic. And what idiopathic means is they don't know the cause and there's no cure. That's the lay
Oh my
explanation
gosh,
of what
that's
that
so
is.
depressing. Okay.
Yeah. Yeah. So that's primary. Secondary means that there's an underlying condition that is related to the burning mouth syndrome. Now, it doesn't necessarily mean that treating the secondary condition is going to get rid of the burning mouth syndrome, but sometimes it does. I have a long list of what those are in my book, but I'll just go ahead and rattle some off. I won't rattle all of them off, but just to give people a sense of. So, mast cell activation syndrome is one of them. Sjogren's syndrome, that's a syndrome where you have a lot of dryness in your eyes and your nasal passages in your mouth. Um, it could be a thyroid condition. It could be a liver condition. Sometimes it's people who have had cancer and have had chemotherapy. It could be a reaction to a high blood pressure medication. I don't know how many I have in my book, probably about 30. And what I suggest to people in the book is go down the list, Google each one of those. And if you have more than one symptom, so more than the burning mouth syndrome that are listed on that, have make a list of those and have your doctor check you for those. That's how it. So this is a disease of exclusion, and
Right.
oral pathologist, which I'll get to in a second, oral pathologist or oral facial specialist, those are the doctors that you should see for this condition, will tell you that. They'll tell you just that. This is a disease of exclusion.
And so you just named two very specialists, but you
Hmm.
started with the doctor who you saw
That's right.
for sore throats and flu
That's
and
right.
your family
Yep.
GP. When you began this, how long ago was this when this started?
So it started in, let's see, my son passed in November of 2021. So it started around December of 2021.
Okay.
My journey through the medical system started the beginning of 2022. So,
2022. Had you ever
yeah,
heard of like an oral pathologist before
no,
you? Okay.
never heard of an oral pathologist.
I just
Nope.
heard about it for the first time
Yeah.
today when you
Yep.
said it. So,
Nope, never heard of it. So the GP that and this is one of the things listed on my in my book on the list of secondary potential secondary issues is lesions on the not necessarily on the brain but on areas like the trigeminal roots or certain nerves in the head that could put pressure on the lingual nerve in the tongue and cause the tongue to have this sensation. So she didn't know all of that, but she thought, well, let's just see if you have a brain tumor.
right. So let's
So
do a CAT
yeah,
scan.
she did an MRI.
MRI. Okay.
So yeah, and that came back normal. So the next thing she said was, let's do food allergy testing. So she did a lot of food allergy testing. So I don't know how many foods she tested, probably 50 or 60. everything there came back normal. I am gluten intolerant, have been gluten intolerant for years, but I wasn't eating gluten, so that wasn't an issue. So then when all that came back normal, she said, I'm going to refer to you to an ENT. So I went to the ENT again, 6, 7 weeks later.
Right.
He gave me a steroid rinse to use 3 times a day for a month. It made it worse, but I kept going with it, thinking, okay, maybe by the end it'll get better. The 30 days came, there was no change. Then he suggested I see my dentist. So then I went to my dentist. My dentist had no idea, just shrugged. But it wasn't a futile meeting because he said, what you need is an oral pathologist. And like you, I had never heard. I was like, what's an oral
Yeah.
pathologist? I've never even heard of an oral pathologist. Fortunately, I lived in Iowa City, and I don't know if you know of the famous University of Iowa Hospital and Clinics in
I
Iowa
know
City.
of the University of Iowa, but I didn't know the
Okay.
rest of that. So,
Yes,
like,
yes.
yeah,
So
so
they have a huge medical center there. One of the most world-class children's hospitals, also at the University of Iowa Hospitals and Clinics. And they happen to have a dental college there. So he suggested that I go to the dental college. So I made an appointment there again, many weeks down the road. So we're probably at this point, getting close to summer by the time all of this was done. So I go to the oral pathologist. She's this, I don't know, 40-year-old beautiful woman with these humongous red glasses, which it was striking as she walked in right away. I liked her immediately. She looked in my mouth. She saw the lesions, but she said everything else looked healthy. I described my symptoms, and she said, you have burning mouth syndrome. I said, I have what? What is that? That didn't come up in any of my Google searches. Now, if you search burning mouth syndrome or even BMS, a lot of stuff will come up. But if you're just searching
yeah.
the symptoms that you're having, it doesn't come up burning mouth syndrome. That was my experience anyway. Maybe it's different now. I don't know. But back then,
That's
that's how it
actually,
was.
you wouldn't know. Well, you would know this if you would listen to like every single episode, but if you didn't, I don't say it in every single conversation, but that's actually one of the through lines of the concept behind this show is that we're in this weird part of the human experience where there's more access to information than ever before, but you have to really know the question you're asking to
Mm-hmm.
get the right answer. So, like, if you, and I have a million examples now that I didn't have several years ago, but when I started and I had the concept, I had a joke. I was like, it's like, listen, the woman or the man, the person who's thinking about getting a divorce attorneys should advertise in Home Depot and the grocery store because
Yeah.
when they're having that inner thought, they don't know who to ask. They don't know the questions to ask. And
Right.
you can't ask the people around you because, those are not the people you're maybe not ready to tell your family and your friends
Right.
and you don't need to talk to your spouse. But, the same kind of thing. If you Google, why am I not happy? You don't get the answers for burnout and overwhelm, right? Like you're asking
Right.
the wrong question.
Mm-hmm.
So, or another one I give is I'm like, you go to the doctor because you have a cough. You don't know you need a pulmonologist. Like somebody has to tell
Right.
you. And
Right.
so it doesn't surprise me to hear that you just discovered it when the doctor said it to you. I do want to ask before we talk about this next thing, at this time when you are going through this process, how frustrating, how much of your life, how much of your day is this impacting? Like, what is life like
My
with it?
thoughts were, I was back to work by that point. I went back to work 3 weeks after my son passed. I don't recommend that to anyone. I think that a loss that significant should be treated like a surgery, 6 to 8 weeks. But my thinking at the time was, what am I going to do? Sit at
Yeah.
home and be in my pool of sorrow? No, I need to get back to helping people, focusing on them. And that's what I did. And then I would come home and collapse in complete exhaustion. While I was working, I was sipping on ice water, sucking on Ricola lozenges. And I should also mention that while this was going on after my son passed, I developed TMJ. So I don't know if your audience knows what TMJ is,
Oh,
but it's
right.
okay.
No,
It's when
tell us. Yeah, tell us.
yeah,
Yeah.
it's when the joints here in your jaw
Right
become
below your
inflamed,
ear.
right
Yeah.
below your ear, become swollen and inflamed. And so then when you open your mouth, it clicks and you have a lot of pain through here. And so, and sometimes this that did not happen to me, thankfully, but sometimes people will open their mouth and not be able to close it again. And they'll have to go to the ER to have assistance in closing their mouth. So I developed that. My GP said, so when I went to my GP, I told her about the TMJ. She referred me to a physical therapist. But
There's
she
no
told me,
doctor in Iowa City that you didn't see.
yeah, exactly. So she told me that I was likely clenching during my nightmares when I was sleeping.
So yeah, just based on who you are and your profession before this, and that you were aware you were going through an extreme
Yes,
grieving process.
I
Was
knew
there a,
everything I was going through.
yeah, was there any part of you or any pushback that you got from the medical team that you were in that this could be related to, the overwhelm of your body and your body going through grief and the physical manifestation of all of that stress?
No. And in
Okay.
fact, the oral pathologist, when I asked her, um, where did this come from? Because she determined that I had primary, because we went through the
Everything.
list,
Yeah.
we did went through the exclusion. No, 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 no. So she said, yeah, you have primary burning mouth syndrome. So I said, where did I get this? And she said, nobody knows. Now, the interesting thing about this is that if we talk about who's at risk, um, 80% of people who have BMS are women, and they are women of middle aged and older. So either
Okay.
perimenopausal or menopausal. So there's a small percentage, about 20%, that are men and that are younger. They're usually secondary BMS, usually. There are some rare cases that have primary, but it's usually that there's some underlying reason why they have BMS. But so there's a lot of hypotheses out there about
Right.
what, where it's what it comes from. So one big one, and if you go to Google Scholar, so Google Scholar is like Google's sister, and it's the website that you can go to look at journal articles, to look at studies. And so I've been there hundreds of times, researching this and many, many other things. And if you go there and you type in burning mouth syndrome, there's going to be a lot of articles come up. So there have been a lot of research teams that have researched burning mouth syndrome, but nothing comprehensive. So they're always, let's try this therapy and research that. Let's try this therapy and research that. So there's really nothing comprehensive out there. And for any listeners that are interested in helping with starting a nonprofit. This friend that I made in the BMS group, her and I are looking at starting a nonprofit to expand research, expand awareness about BMS, because just like I mentioned to you, I love my GP and she was amazing, but she didn't know what it was. She should know what burning mouth syndrome is. There should be enough awareness that all doctors should know what this is. About 3% of the population is afflicted with this condition.
It's pretty
And
big,
so
actually,
it is pretty big.
in terms of
Yes.
rare diseases, right? That's like when we talk
Yes.
about rare diseases, we're talking about like 0.5% or
Yep.
1% is a pretty and so okay. That was my instinct, but if
Yeah.
anybody's watching the video, you'll see me screw up my face in that. Do I know anything about this? So that is really, really interesting. So you shared that this experience shifted how you lived, thought, and related to others. Tell me more about when that started to happen and what was going on.
So because this was so all consuming to me, um, with grief, time is medicine. So as time goes by, you learn how to live with the loss that you endured. So time went on, of course I had waves, I something would pop up, on my phone, an old photo from Facebook or something like that. Or one day I came across a voicemail I didn't know I had from him. And I broke down from that. So you're going to have, things like that when you have a major loss where you have a wave of grief. But for the most part, life resumed, fairly normally. I have a wonderful husband who was my rock through the whole thing, wonderful children, great family. So I had great support, but I had this going on and I didn't know how to talk about it. I didn't know how to explain it to people. Um, and people around me, unless they asked questions, I didn't really bring it up, and people didn't say, hey, how are you doing with that burning in your mouth? It just
Right.
didn't really come up. So sitting at a dinner, for example, or going out with friends, I'm sitting there, my mouth is on fire, and everybody's just, talking and enjoying themselves, and I'm just faking it, trying to go along and have a good time and not bring other people down. I'm not going to sit
Yeah.
there and go, hey, by the way, everybody, my mouth is on fire and I feel like I want to run out of the room. I'm not going to bring it up. So I'm just going to try to integrate myself as best as possible. And so it wasn't really until my book came out and my family members read it that they came back to me and said, oh my God, Peggy, I had no idea. I thought this was you ate a food and it reacted and then you were fine after that. Or I thought this was something that came and went. And, I didn't know that you were suffering with this 24/7. So the isolation that one feels, and it's not just me. If you go on to the support groups on Facebook, on these burning mouth syndrome support groups, so many sufferers will post, I feel so isolated. I feel so alone. People don't get it. My family tell me, just don't think about it. Doctors are saying, just don't think about it. Get a hobby. I mean, things like that,
Yeah.
where they're dismissed. And so that was the life I was living for a really long time. And I didn't know really where to go with it. Um, the oral pathologist, she told me her parting words to me were after she prescribed the typical um, remedies that they give for people with burning mouth syndrome is capsaicin therapy. I don't know if you know what that is.
That's the spice. That's things. That's the part of a pepper that makes it spicy, right?
Yes, yes.
Okay.
So it's the
Capsaicin.
easiest way is you mix, a little bit of water with a little bit of Tabasco sauce and you swish with that and you spit it out. Now, everybody who reads that or hears me say that says, "What? Why in the world would I put my mouth more on fire than it is already?" But what it is, it's a desensitization therapy. So it's like I guess it's like facing a fear. The
Yeah.
fear shrinks, so it's kind of the same way. You put this burning in your mouth, and then when that burning from the Tabasco sauce subsides, you get some relief from the burning of the burning mouth syndrome for about 2 hours. Sometimes I'll get maybe 3 hours of relief, but it's usually about two-ish hours. So it was that plus clonazepam, which is the
Okay.
generic Klonopin. It's a wafer that you suck on until it dissolves, and then you spit it out. And so that's what she prescribed to me. And it didn't really do too much for me. It made me very tired.
I was going to
Uh,
say, I think that people use that
yeah,
for nighttime with some other things like maybe anxiety.
yes, yes.
Okay. All
So it
right.
made me very tired. So I did start using it just at night because
Okay.
being a therapist, I couldn't be like nodding off while I'm doing therapy. So I started doing it just at night, and I just sucked on my Ricola lozenges just all day long and drank ice water. Those were my two things that I did to get through the day.
So there is that very old fashioned kind of joke that is that doctors make terrible patients.
Yeah,
Right. Okay.
yeah,
So do
yeah.
you think, I mean, because at this point you are both a doctor and a patient. Do you think that your experience with helping people follow treatment regimes as a doctor made you more or less willing to follow the advice of swish Tabasco water and take the medicine?
I went in as a patient as a desperate patient, willing to try pretty
Try
much
anything.
anything.
Eat
Yeah,
raw
to
eggs
try.
at 3 a.m. Sure, you got it.
Yes,
I'll set my
yes.
alarm.
Pretty much ready to
Yeah.
try anything. And so that really didn't interfere. The thing I think that maybe did, I don't know if interference is the right word, but being a clinical psychotherapist, I knew minute by minute what I was going through. So when I was going through the grief of the loss of my son, I had some PTSD from the way that he died. I, developed, sleep problems. I was having panic attacks. There was a lot of things that were going on. If I were a lay person, I'd be like, "What's happening to me? I don't, I
Yeah.
can't handle it." I knew exactly. In fact, I was journaling about everything and, putting also not just as a patient, but, looking through the lens of a clinician and writing down, this is the diagnosis and, writing down all the different things that I was experiencing. And then as a burning mouse syndrome patient, I was out of my element because that wasn't anything that I was really familiar with. So that lens didn't really come through. I really was purely a patient in that situation. But the parting words of the oral pathologist in Iowa City was give it 3 years.
Oh,
And it didn't really hit me until I got to my car. And I thought, I don't know, can I cuss on this
yes, you sure
podcast?
can.
Okay. When I got to the car, I thought, 3 fucking years?
Right.
What? How can I can't even handle another 3 days of this, let alone 3 years. So, but the reality is, here I am almost 4 years into it.
Right, because you really don't have
So,
a choice. 3 years is an interesting number. It's interesting that she said that because that happens to be, if you go back and you interview people who have hard to diagnose things, sort of the
mm,
autoimmune field of things that are also semi-exclusionary. Some of them have tests and some of them don't. That's the average it takes for people to get
oh,
a
okay.
diagnosis, which just seems like such a long,
Yeah,
painful road, and yet it sounds to me like that's very much kind of the situation that you were
yeah,
in, is that it's like I don't have any other choice here. Like my
yes,
only choice here is to keep pressing and keep digging.
yeah,
So you shared in the pitch that you made a choice that you were going to study everything that you could about this
yep,
condition. And so when I felt that, this is my reaction to that, is I was like, that seems like that was kind of the only choice because nobody was giving
hmm
you a map of
hmm
instructions.
hmm
But I guess on the other hand, right, you could have just thrown your hands in the air and been like, it is what it is, and this is my plight
hmm
to just move on with. So share. So when you were choosing to research, was this as you were going to the doctors, or was it after the oral pathologist confirmed this and you committed to learning
After
about
the
it?
oral pathologist confirmed it. Once I knew what it was, once I knew the name of it, then I was like, okay, I have something to research.
Oh, so you
So,
you turned
yeah,
on your research. You're
yes,
professionally trained to research these things and do this. So
yes,
you turned to your training and you were like, I know how to do this part of it. Let's
yes,
go.
yes, yes. So I started going to the articles. I also joined the Facebook groups because I wanted to track and be a part of the community. First off, because I'm a patient as well,
Yep.
not just a voyeur looking at these groups, but also I was interested in what the experiences of the lived experiences of real people today living with this condition. And oh my gosh, the things that I learned from that group, there are people in that group who've had this 35 years.
Yeah.
There are people who've had it 25 years, 20 years, 12 years. So back to the
Clearly,
research.
none of them have come up with something that makes it go away.
Right. That's right.
That's very
That's right.
sad. Yeah.
Yes. So from my research, what I have learned is that it's not just idiopathic. They do know that this is neuropathic. So it is nerve related. It is not people have
Which
found
that's why
out.
it doesn't respond to anything because it's
That's
nerves.
right. It's the
Yes.
nerves. Yes. So it's overactive nerves in coming from the trigeminal roots in the tongue, which is the lingual nerve. Now, so for people who get it in their nasal passages or in their gums or in their throat, obviously those are other nerves that are firing, not just the lingual nerve, but that's in addition to the lingual nerve. But the one I have, it's just my tongue. Thankfully, it's just my tongue and not the other parts of my mouth. But other people can have other parts of their mouth. Now, I should say that there is another condition called trigeminal neuralgia. Now, that condition is, from comes from the trigeminal roots, and it affects the face. You can have burning mouth syndrome from that, but those people, even the wind blowing a hair against their face can be painful.
Oh.
They just have a lot of really sensitive nerve pain in their face and jaw and places like that. So, and that's one
And
of
for people
the
who are
underlying
watching
causes.
the video, I began to grin while she was describing this. And the thing that was going through my mind is that like I make captions for all of these interviews, and I am super excited to see what the caption software does with all these very complex words that you're using in
Oh,
this interview. Like, and so you were saying transgenital, and I was like, oh, I don't know how they're going to spell that. We'll see.
trigeminal, yeah. Trigeminal
Trigeminal.
neuralgia. Yeah,
We're
yeah.
gonna see. All right. So you dive in and you're researching this and you're joining the groups and you're learning all of these things and you're putting together this bulk of information of your experience and other people's experience. At some point, you decide to write a book. And I mean, you've mentioned it as we were talking about it. But one of the things that I think is interesting about this and I want to ask you about your thought process and if you can help us understand it, because you were dealing with your own issue. You actually didn't have to write a book. You just could have had a binder
Right,
of your research that
right.
you could have shared with your friends as you met them. You could have become the most experienced, most helpful person in the user groups that you were a part of, and just done it that way. What was it in your experience that made you think, you know what I'm going to do is I'm going to write a book and I'm going to put it out there for the world? Take us through making that
Yeah,
decision.
that's a great question. So there was a precursor to that, and that was my husband and I moved to Athens, Georgia. First off, I felt like everything about Iowa reminded me of my son, and I
Clean
really
break,
needed
yeah.
to, yeah, clean break. Also, my husband's parents live down here, and we thought it was a good idea to come down here because his mother has been not in good health. So, just with those two things, we decided to move down here. So, I needed to get a new oral pathologist. So, I did, they didn't have one in Athens. I had to drive to Atlanta. Well, I shouldn't say they didn't have one. They had one. I had one visit. He said he knew what burning mouth syndrome was, handed me a pamphlet that told me everything I already knew, and said, there's nothing I can do for you. So that was the results of that appointment. So then I went to this oral pathologist in Athens. And I told her I had already had the burning mouth syndrome, but I needed somebody who was going to uh, follow me and maybe come up with some other treatments. So I should say that before my husband and I moved to Athens, we took a trip to Alabama, the coast of Alabama, as a vacation. I wanted to get away. And while I was there we were there for 7 days, and the first 5 days, the burning mouth syndrome went away. I still to this day cannot explain why. Maybe I was more relaxed. I don't know. On the fifth day, it came back, and it came back about 10 o'clock in the morning. And I said to my husband, I don't understand what I did differently today from other days, except I ate blueberries in my yogurt. And I eat yogurt in the morning. And I had eaten yogurt the other mornings, but I hadn't had any fresh blueberries. We had found a little stand where we bought some fresh blueberries. So I put those in my yogurt the next morning. So fast forward to seeing this new oral pathologist in Atlanta. So I told her about that experience. And she said, first of all, it's not unusual for people to go on vacation and for their burning mouth syndrome to take a respite. And they think it's because of nervous system
Yeah.
relaxation and things like that. Um, then I told her about the blueberry situation, and she said, "Oh, well, I can tell you what that's about." She said, "Blueberries are high in arginine." And I was like, "What's arginine? I don't even know what arginine is." She said, "Arginine is an amino acid, and it agitates BMS." And so she said, what I want you to do is I want you to eat foods that are higher in lysine than arginine. Now, I should mention as a side that diet is not new. It's been around for a long time and recommended to people who have HSV and shingles.
Okay.
So what it does is So both of
HSV
those
is
oral
human.
herpes.
Okay, yeah, that's the one. Which now that's the one we give the vaccine for. Is that the one that the kids get the vaccine for now?
No, no, that one's for
The
the
other type of
cancer.
herpes.
Yeah, the cancer.
Oh,
Yeah, the
that's
other kind
right.
of,
That's right.
yeah, the
Okay,
cancer.
so sorry. All
Yeah.
these letters and things. You're the doctor. I'm in over my head trying to keep up. Okay, so
Yeah.
higher in lysine than the other thing,
Arginine. Right.
arginine.
Yes.
The
Yes.
blueberries
So
don't come with labels about this, by the way.
no, they do not. So, arginine, what it does is it replicates viruses, and actually not just shingles and oral herpes, but also COVID. So, anybody who gets COVID should eat a high lysine, low arginine diet while you're recovering, because and the other thing about these viruses is they live in the face, in the oral areas.
Okay.
So HSV and shingles both live in the trigeminal roots of the face. So
I'm
so
totally
I
making myself a note. High lysine.
yeah. So I went home, and it's not as though she handed me a booklet that said, here's your diet, that follow
Yeah.
this diet. She just said, oh, eat foods higher in lysine
Which I don't
than
even know
arginine.
what has lysine in it. That's like, so yes, okay.
So there, I had to go into research mode again and do that deep dive. And I did stumble on a website, a beautiful website that all you have to do, it took me a while to stumble on it, but I found it. You just have to type in the food, and then it prints it, it lists all of the different nutrients in that food, including lysine and arginine. So what I did was I started making myself a chart, and I put that chart in my phone. So everywhere I went, I'd go out to eat, I'd pull up my chart. Okay, can I have this? Can I have that? Da, da, da. And what I noticed is my symptoms started coming down drastically. And
Wow.
so we in the BMS world, or in the pain world, talk about pain on the scale from 0 to 10. And so before starting on the diet, even with doing the capsaicin and the swish at night, my pain was still 8 to 10 every day.
So I've
I mean,
had people ask me
unbearable.
that. I've had people ask me that when I'm in like, over the years, like a nurse will say, what on a scale of 1 to 10, where is your pain? The funny thing about that scale is you don't know what a 10 is
Yeah,
until you know,
until you
it's
have a
like,
10.
right. So it's
Yeah,
like, you start and you're like, I think I'm at a 10. And like, and then if it gets worse, it's like, I thought that was a 10, but now I know that that was a 5. Now we're at a 10.
right. Right. Exactly. Exactly. Yeah, I think people who have given birth know what a 10 is,
Or broken a bone.
or broken a bone, or
Yeah.
something like that. They know what a 10 is.
Taking a
Uh,
shower after a bike accident where you scrape off your skin or
right. Yes.
skateboard, something like
Yes.
that,
Yes.
yes,
Yes.
yeah.
And the reason that I would put the burning mouth at an 8 to 10 is because of the how constant it is.
Right, which
There's
is a
no
whole
there's
thing.
no
Yeah.
no let up. It's
Right.
just constant. And so once I got on the diet, I would say it got down to around a 3 or 4.
That's a major
And so
improvement.
major improvement. So I
So
said,
give me an
okay.
example of this is not really a how-to show, but I am very curious. What's a food that's high in lysine?
So blueberries is one of them. So there are a
Okay.
number of fruits that are low in arginine, and some that are high. So it's not like oh, you can't eat fruit anymore. No, you have to figure out which are the fruits that are high in lysine and which are the fruits that are low. So pears, apples are low in arginine.
Okay.
Blueberries, raspberries, most berries. I think the only berries that are not high in lysine are wild blueberries, which I eat every day, and strawberries. All the other berries
Ah,
are off limits. Nuts and seeds, very high. Wheat and other grains like rice and things like that, very high in arginine. So I was already on a gluten-free diet. So that wasn't a big stretch for me. That I think is difficult for a lot of people to switch over to not eating wheat anymore, or not, especially Asian people who eat rice every day, not eating rice. Um, Fortunately, I'm vegetarian, so this is not a benefit to me. But fortunately, for a lot of people, all the meat is okay. So
yeah.
all meat is higher in lysine than it is in arginine. All dairy is okay. Most fish, except for shellfish. Shellfish is one that is higher in arginine and lower in lysine.
That is
So
super interesting. All right.
yeah,
That is amazing. So you stumble onto this based on
yeah,
eating a blueberry and telling the
yeah,
doctor and having the one specialist in the state that is like, I know what that is.
Yes.
You build your diet. Okay, so you're writing. I think we started this before my curiosity about arginine and lysine. I think we started this with like, what was it that turned you into writing the book?
To writing the book. Yeah.
Yeah.
So that was the beginning, was once I knew I was on to something, this arginine, not just me. I mean, obviously it was the oral pathologist who was onto it. I started doing research into BMS and high arginine or low arginine diet. I couldn't find a thing on it. Nothing. Zero, zero, zip. There's still nothing on it. So, and even went into the journal articles and found nothing on it. And on top of that, my follow-up appointment that I was supposed to have with this oral pathologist, I got a call back and they said, sorry, she's left the state and left the practice. We've referred you to someone else. I'm like, what the heck? I
All right, I
finally
can't.
find
Yeah.
somebody who knows how to treat this thing and she's gone. And I tried to find her in other states. I emailed her 3 times at the only email that I had, never heard anything back. So she just disappeared. So once I realized there is no information out there on this, that was when I said to my husband, I'm writing a book on this. I got to get this information out.
That
So
is really
that was
interesting.
the
All
decision.
right. So that is very cool. All right. So a lot of people who have an experience like this, where they are in the spot where they become the detective and they, through their journey and their connections and so on and so forth, what they do is they turn their life around and actually, sometimes turn their job into helping other people in a similar spot.
Yeah.
Um, I don't think you did that. I think you're still working as
Yeah.
as
I'm
a
still a psychotherapist. Yep.
so you're still a psychotherapist, but how did, if any way at all, I don't know that did, how do you think that your experience with chasing down this diagnosis, finding somebody who could help you, the doctor chase across the country, how might it be affecting how you show up in your other professional role these days?
It is a juggle. I have to tell you, it is a juggle. I really have to turn off, do my best to turn that part of my life off when I come into the consultation room. Because it really is, I have to just take one hat off and put the other hat on. It's not always easy to do because sometimes I might do a podcast interview an hour
Yeah.
before I have, a patient, or I might have one right after, or I might be writing and then I have an appointment, an hour later or something like that. So it really is not an easy shift, but I have, since I've been doing it for so long, the book was published in this past August, but it took about 9 months or a year for me to write the book and finish it, and to get it published. So, and get the website up and all of that. So I've figured that out now. And I think I walked that path pretty well. But as we talked about before you started recording, I have a third book that I've been working on for about 8 years off and on. I put it down when, obviously I put it down when my son passed, and there's been different things that have come up in my life. Let's just put it this way: my life has not been as easy. It's been a rocky life, from beginning to now. Um, and so juggling all three of those things at the same time have not been easy. But I just try to be efficient with my time and try to carve out the time that I need for each one of those to devote what I need for each one of those.
So, yeah,
And I,
my question was actually a little bit of a different angle. So let me rephrase it because I didn't do a good
okay,
job of asking it. Do you think so? You were working as a clinical psychotherapist before and listening to the descriptions of people and helping them find their path through whatever they're working on, trauma or whatever. That's your
yeah.
profession. And do you think that this experience that you went through as a patient who struggled to find a diagnosis and a working therapy, has that turned around and impacted how you interact with your therapist with your clients as a therapist?
Oh, I see the question. Okay,
Yeah.
I'm sorry, I misunderstood.
No, that's my fault because that means I
Yeah.
didn't ask a good question.
Well, yes, I would say yes, in the sense that it has made me a lot more. Now, I should say that I have struggled with chronic pain since 1995 when I had a car accident. So I've struggled with chronic pain in my neck and my back. So I've not been uh, clueless about chronic pain. But this chronic pain has really escalated my empathy that I have for people who experience chronic pain. And I have a number of patients who experience chronic pain
Yeah.
for various reasons. So I would say, in that sense, yes, it has influenced or informed me in the way that I approach my patients who are experiencing chronic pain. And also the loss of my son, which the loss of my son was really the first major loss that I've had in my life. And I've had many patients over the years who've had major losses, and I've,
Yeah.
been there for them. But now I feel like with that loss, my showing up for them is different. It's better. It's more authentic.
It is this, I will say that as a human being, there's no way to fix this, right? Not every helper can have every experience for the people they help them. And we
Right.
do, but I've had several people on the show who've talked about grief, and I've experienced grief in my own life. And with not the same type of grief you had. I've lost my parents. So that's
I'm sorry.
and so thank you. It's been a long time. So it's like, but it is a shocking thing to go through no matter where you are and who you are. And it's super interesting because, it is it's not the way you think it's going to feel.
Mm-mm,
And it does change the way you interact with anybody else that you run
mm-mm,
into in that experience. And that is one of the things that shape that question, because all the time we're in a position, especially when we're young professionals, we're very frequently in a position where we're trained to do something that we don't have a full lifetime of experience doing. Obviously, we don't. We're
mm-hmm,
young. We're young. We don't
mm-hmm,
have it yet, right?
mm-hmm,
And then as we get more experience, we have more knowledge and awareness, and then that shapes how we are able to do things. And it's just a wild thing about the human experience, but specific to grief, I've seen it, over and over again. When my dad died, I had this very interesting sensation that was wrong, that I didn't know anybody who had gone through that. But I knew all these, like my in-laws, other adults, in my life that were, in their 70s. They had obviously gone through the process of losing their parents, just because well, not obviously, but they were more likely. And I just didn't even think of them. I was like, nobody knows what I'm going through. But many people did.
mm-hmm, mm-hmm,
So once I found them, they were able to help me.
mm-hmm,
All
mm-hmm,
right, so let's talk about this. We'll wrap this up. You have an offer for the listeners, which is okay. So you have a burning mouth survival guide, which is
mm-hmm,
available on your website, the Peggy Sharr, which is peggysharr.com, and that link is in the show notes, for everybody that's there. You have a newsletter that is probably a side effect of getting the survival guide, and depending on when people listen and respond, you're working on your memoir,
mm-hmm,
which is currently called Surviving the Family Kingdom. And there's a
mm-hmm.
couple chapters, beginning chapters, that are available that they can get as well.
Correct. Yes. Yes. Mm-hmm.
Very generous offer. I want to say thank you very much for that very generous offer. I could talk to you all day, but are you ready to wrap this up with my final fun questions?
Let's go for it.
All right, let's do it. What is a hobby or passion? I didn't know you were working on another book at the same time. You may not, I'm curious to know if you have an answer to this. What is a hobby or a passion that you enjoy outside of work and family?
Painting.
Painting.
I love, well, two big passions. One is painting and one is dancing. My husband and I do Latin dancing.
Oh, spectacular. Okay.
Yeah.
That both of those are fun. Okay, very, very good. For people who are watching on the video, I asked this of Peggy before we started, but she painted the beautiful flowers that are behind her in the video. Okay, so this one, here we go. Thinking back to younger you as a teenager in like high school, say, to give it a time frame, what was one of your favorite musical artists, like band, singer, whatever you liked, that you loved enough that you played it on repeat?
Michael Jackson.
Michael Jackson, that's a
Over
good
and
one.
over and over.
Okay, so now follow-up question for that one. Do you still have Michael Jackson songs in your playlist that you listen to today?
Yes, I
Very
do.
cool. Okay, bonus question. I'm sneaking this one in because I figured that was a point 0.5 part of the question, because I usually limit to 3. How do you listen to your music these days? Are you on Apple Music,
Oh
Spotify?
my
How do
gosh,
you?
I am so old fashioned. My husband and I listen to vinyl.
Oh, nice.
And yes, lots of vinyl. We have I wouldn't say an extensive vinyl collection, but we are in the collection process. So we have a record player and we play vinyl. We're both big jazz fans, and
Very
then we
nice.
also listen to CDs. So we still listen to our CDs that we have. But I'm not an earbud person. I'm trying to preserve my hearing for when
Yep.
I'm old. So, most music is not listened to through my earbuds. So I don't listen to my phone and that sort of thing. It's really through my stereo.
Through your stereo
Um,
with a vinyl
yeah,
collection. I
yeah,
am so impressed by that because like I am I'm sort of the opposite. I am somebody who's like rebuilt my collection. Like it's like first I had like albums and tapes and then I had CDs and then
yeah.
I had an iPod and now I have then I had Pandora and now I have Spotify. It's like how many times am I going to buy these albums?
Yeah.
It's so funny. All right, that's it. Peggy Sharr, thank you so much for being a wonderful guest today on the show.
Thank you for having me. I really appreciate it. I enjoyed it.
Thank you for listening today. I hope that you enjoy the show. And before I go, I want to encourage you to become a bigger part of the conversation. Obviously, subscribe wherever you're listening to the show. Listen to more episodes. That'd be great. Again, please write a review and tell your friends about the show. That truly is a great help for getting the show in front of new people. Okay, but more fun for you yourself, head over to imperfectadulting.com and join the email community. You'll get some free stuff right away, and that way you'll begin to get the emails about the podcast. This includes the links for the special offers from the guests, and it's the only way to get that. Also, if you aren't in the mood to listen, I actually include an article directly in those emails. Whee! Now, if you love this and you crave more time with me, Amy, as a coach, a mentor, or just adultier adult, numero uno, check out The Village. If you have a story you want to share with the listeners, I'd love to hear from you. I have an open application. Just let me know you want it. And that's a wrap for today. Until next time, remember, the journey is the destination. Ralph Waldo Emerson said that, not me. Well, until just now, I did just say it. But what I want you to hear today is that if your adulting journey isn't going the way you expected, that may not mean that you're lost. It may just mean that you're on your way. This is Amy Stone, signing off. The Imperfect Adulting podcast is created and produced by Amy Stone and Amy Says So. Anything expressed on this show is offered as entertainment, and the views of the guests may not always represent the ideas and viewpoints of the host. That's me. Amy does not intend or hold herself out to provide professional advice or recommendations of any kind. In the end, you and you alone need to make those kinds of decisions based on your personal and individual situation, needs, circumstances, and comfort level.